Did you know there's a vitamin that could potentially reverse kidney disease, even at its later stages? It's a game changer in the world of health and one that most people don't know about. Stick around as we dive into this remarkable discovery, exploring the science, benefits, and practical ways to harness this secret vitamin for better kidney health. Number 1. What is the secret vitamin? The secret vitamin that holds transformative potential for kidney health is none other than vitamin D, aptly nicknamed the sunshine vitamin. This essential nutrient goes beyond its well-known role in supporting bone health. Recent studies have uncovered its powerful connection to kidney function and overall systemic well-being. Vitamin D is not just a nutrient but also a hormone precursor. When activated by the kidneys, it transforms into its biologically active form, calcitriol, which is crucial for maintaining healthy kidney function. This active form plays a vital role in regulating mineral balance, particularly calcium and phosphorus, which are central to kidney health and preventing complications like bone disorders or calcification. Additionally, vitamin D is a multitasker. It impacts numerous cellular processes. By binding to vitamin D receptors located in kidney cells, it influences gene expression, aiding in repairing damaged tissues and reducing scarring within the kidney structures. This hormonal action makes vitamin D an integral part of the kidney's protective and regenerative mechanisms. Interestingly, research also points to vitamin D's ability to reduce the risk of chronic kidney disease (CKD) progression. It does so by acting as a natural anti-inflammatory agent, suppressing harmful inflammatory pathways that can accelerate kidney damage. Despite its importance, a surprising number of people are deficient in vitamin D due to inadequate sun exposure, poor dietary intake, or the body's reduced ability to synthesize it with age. For individuals with compromised kidney function, supplementation under medical supervision becomes even more critical, as their ability to activate vitamin D diminishes. This secret nutrient isn't just about maintaining kidney health, it's about unlocking the body's potential to heal and protect itself from further damage. Its unique mechanisms make it a cornerstone of kidney disease prevention and management. Number 2. How vitamin D helps reverse kidney damage. Vitamin D plays a multifaceted role in addressing and potentially reversing kidney damage through its profound effects on cellular and systemic health. One of its primary actions is regulating calcium and phosphorus metabolism. By ensuring these minerals are in balance, vitamin D prevents complications such as calcification in the kidneys, which can worsen damage over time. More importantly, vitamin D functions as a natural anti-inflammatory agent. Chronic inflammation is a major contributor to kidney damage, and vitamin D helps by suppressing the release of pro-inflammatory cytokines while promoting anti-inflammatory responses. This action reduces swelling and irritation in kidney tissues, giving them a chance to heal and regenerate. Beyond inflammation, vitamin D has shown promise in slowing fibrosis, a process where scar tissue forms and replaces healthy kidney tissue, leading to progressive loss of function. By inhibiting the pathways responsible for scarring, vitamin D helps maintain the structural integrity of the kidneys. Another significant benefit is its impact on the renin-angiotensin-aldosterone system, RAS, which regulates blood pressure. Overactivation of RAS is common in individuals with kidney disease and can lead to high blood pressure, further straining the kidneys. Vitamin D helps modulate this system, keeping blood pressure under control and reducing the risk of additional kidney damage. Furthermore, vitamin D supports the immune system, reducing the likelihood of infections that can exacerbate kidney conditions. It also enhances the repair mechanisms of kidney cells by activating specific genes involved in cellular growth and regeneration. Emerging research even suggests that vitamin D might help combat oxidative stress, a condition where harmful free radicals damage cells. By acting as an antioxidant, vitamin D mitigates this damage, protecting kidney tissues from further harm. Number 3. Regulating calcium and phosphorus levels. Vitamin D is essential for maintaining the delicate balance of calcium and phosphorus, minerals that play a crucial role in bone health and overall metabolic function. When the kidneys are damaged, their ability to filter and regulate these minerals becomes impaired. This can lead to dangerous imbalances, such as elevated phosphorus levels or reduced calcium absorption, which in turn cause complications like brittle bones, vascular calcification, and further kidney stress. By activating vitamin D, The body ensures that calcium is absorbed efficiently from the digestive system and delivered to where it's needed most, such as the bones and teeth. Simultaneously, it helps regulate the release of calcium from bones when blood levels are low, ensuring that essential processes like muscle contractions and nerve signaling are uninterrupted. Phosphorus, another mineral that is tightly controlled, can become excessive in the blood during kidney disease. Elevated phosphorus levels can lead to calcification of blood vessels and tissues, further straining the kidneys and increasing the risk of cardiovascular complications. Vitamin D works to manage phosphorus levels by enhancing the excretion of this mineral through the kidneys and maintaining its balance with calcium, minimizing these risks. Additionally, vitamin D plays a pivotal role in the production of parathyroid hormone, PTH. When calcium levels drop due to kidney dysfunction, PTH levels can rise excessively, leading to a condition called secondary hyperparathyroidism. This condition accelerates bone loss and worsens mineral imbalances. By ensuring proper calcium and phosphorus regulation, vitamin D helps prevent this cascade of events, protecting both kidney and bone health. Number 4. Combating inflammation. Inflammation is a major contributor to kidney damage and the progression of kidney disease. When inflammation persists, it can impair the kidney's ability to filter waste and balance essential fluids and electrolytes in the body. Vitamin D, often termed the sunshine vitamin, has been found to have potent anti-inflammatory properties, making it a valuable tool in protecting kidney health. Vitamin D works by modulating the immune system. It helps suppress the activity of overactive immune cells that can mistakenly attack healthy tissues, including the kidneys. By reducing the production of inflammatory cytokines, chemical messengers that promote swelling and tissue damage, it helps create a more balanced immune response. Furthermore, vitamin D increases the production of anti-inflammatory compounds, such as interleukin 10, which helps soothe inflammation and prevent chronic damage. This balancing act reduces the burden on the kidneys, allowing them to function more efficiently despite the presence of disease. Chronic kidney disease often triggers systemic inflammation, which can extend beyond the kidneys, affecting the cardiovascular system and other organs. Vitamin D's ability to combat this widespread inflammation reduces the risk of associated complications like heart disease, a common issue in those with kidney conditions. Moreover, studies suggest that vitamin D deficiency is linked to increased levels of C-reactive protein, CRP, a marker of inflammation. By maintaining adequate vitamin D levels, patients can lower CRP levels and reduce the overall inflammatory load on their body. Number 5. Supporting blood pressure control. High blood pressure is a leading cause and consequence of kidney disease, creating a vicious cycle that can accelerate damage. Vitamin D plays a vital role in breaking this cycle by helping regulate blood pressure levels, which directly benefits kidney health. Vitamin D supports blood vessel health by enhancing the production of nitric oxide, a molecule that relaxes and widens blood vessels, improving blood flow and reducing strain on the circulatory system. This vasodilation effect lowers blood pressure, easing the workload on the kidneys. When blood vessels are flexible and open, the kidneys are better able to filter blood efficiently without added stress. Additionally, vitamin D helps control the activity of the renin-angiotensin-aldosterone system, RAS, a hormonal pathway that regulates blood pressure and fluid balance. Overactivation of this system often leads to elevated blood pressure and fluid retention, both of which can harm the kidneys. By suppressing excess renin production, vitamin D helps maintain balance in the RAS, preventing unnecessary spikes in blood pressure. Another way vitamin D supports blood pressure control is by reducing inflammation and oxidative stress in blood vessels. Chronic inflammation can lead to stiffening of arteries, a condition known as arteriosclerosis, which raises blood pressure and forces the kidneys to work harder. By mitigating these effects, vitamin D helps maintain healthy vascular function. For individuals with kidney disease, managing blood pressure is critical to slowing disease progression and minimizing complications. Ensuring adequate levels of vitamin D can significantly enhance the effectiveness of other blood pressure management strategies, such as medication, diet, and exercise. Number 6. Enhancing immune function. Vitamin D plays a pivotal role in fortifying the immune system, which is essential for protecting the kidneys from infections and autoimmune disorders. The kidneys are particularly vulnerable to damage from chronic inflammation or immune system overreactions, and vitamin D helps maintain a balanced and effective immune response. One of vitamin D's key contributions to immune health is its ability to activate T cells, which are crucial for identifying and destroying harmful pathogens. Without adequate vitamin D, these cells remain dormant, leaving the body, and the kidneys, more susceptible to infections. This is particularly significant for those with kidney disease, as weakened kidney function often compromises the immune system. Moreover, vitamin D helps reduce the production of pro-inflammatory cytokines, proteins that can exacerbate inflammation if produced in excess. Chronic inflammation not only impairs the immune response but also accelerates kidney damage by attacking healthy tissues. By regulating cytokine activity, vitamin D acts as an anti-inflammatory agent, reducing the risk of immune-related kidney issues. Vitamin D also supports the health of the epithelial cells lining the kidneys and urinary tract. These cells form a protective barrier, reducing the likelihood of infections like urinary tract infections, UTIs, which can strain the kidneys. A strong epithelial defense, enhanced by vitamin D, minimizes the chances of bacteria reaching and damaging the renal system. In autoimmune conditions such as lupus nephritis, where the immune system mistakenly attacks kidney tissue, vitamin D can help modulate the immune response to prevent overactivity. It achieves this by influencing regulatory T cells, which ensure that the immune system targets harmful invaders without attacking the body's own organs. Number 7. Role in preventing proteinuria. Proteinuria, the presence of excess protein in urine, is a key indicator of kidney damage and dysfunction. Vitamin D plays a significant role in protecting kidney structures to prevent this condition. By maintaining the integrity of the glomerular filtration barrier, a critical structure in the kidneys responsible for filtering blood, vitamin D ensures that proteins like albumin stay within the bloodstream, rather than leaking into the urine. One of the ways vitamin D supports kidney health is by regulating the expression of podocytes, specialized cells in the glomerulus that form a selective barrier. These cells prevent large molecules, such as proteins, from passing through. Insufficient vitamin D levels can lead to podocyte damage, increasing the likelihood of proteinuria. Additionally, vitamin D reduces the activation of the renin-angiotensin-aldosterone system, RAS, which is closely linked to blood pressure and kidney function. Overactivity of the RAS not only contributes to high blood pressure but also increases pressure within the glomeruli, causing them to become more permeable and allowing proteins to escape into urine. By suppressing excessive RAS activity, vitamin D helps protect the kidneys from this stress. Another crucial mechanism is vitamin D's anti-inflammatory effect, which helps mitigate damage to the delicate tissues of the kidneys. Chronic inflammation can degrade the glomerular structures, worsening protein leakage. Vitamin D's ability to suppress pro-inflammatory markers ensures that the kidneys remain healthy and functional. Emerging research suggests that vitamin D can also modulate oxidative stress within the kidneys, a condition where an imbalance between free radicals and antioxidants causes tissue damage. By reducing oxidative damage, vitamin D supports the kidney's filtration capacity and minimizes protein loss. Moreover, studies have observed that individuals with sufficient vitamin D levels experience improved protein reabsorption capabilities in the renal tubules. This means that even if small amounts of protein enter the urine, the kidneys can recover and retain them efficiently, reducing overall protein loss. Number 8. Slowing the progression of CKD. Vitamin D plays a pivotal role in decelerating the advancement of chronic kidney disease (CKD) through several interconnected mechanisms that safeguard renal function. Its protective effects extend to both structural and functional aspects of the kidneys, offering a comprehensive defense against further decline. One key way vitamin D slows CKD progression is by regulating parathyroid hormone (PTH) levels. Elevated PTH, common in CKD patients, can lead to a condition known as secondary hyperparathyroidism, which contributes to kidney tissue damage and worsens renal function. Vitamin D helps normalize PTH levels, reducing strain on the kidneys and preventing further deterioration. Another vital function is vitamin D's ability to stabilize calcium and phosphorus metabolism, two elements that, when imbalanced, can cause calcification in kidney tissues. By maintaining proper mineral levels, vitamin D protects kidney structures from accumulating harmful deposits that exacerbate CKD. Vitamin D's anti-inflammatory properties are also instrumental in halting CKD progression. Chronic kidney disease often triggers persistent inflammation, which accelerates scarring, fibrosis, in kidney tissues. By reducing inflammatory markers and cytokines, vitamin D preserves the delicate architecture of the kidneys and limits the spread of damage. Furthermore, vitamin D enhances vascular health, which is critical for optimal kidney function. Poor blood flow to the kidneys, often due to hypertension or vascular calcification, can hasten CKD. By improving endothelial function and reducing arterial stiffness, vitamin D ensures that the kidneys receive adequate oxygen and nutrients, promoting their overall resilience. Another significant contribution of vitamin D is its ability to suppress the overactivity of the renin-angiotensin-aldosterone system, RAS. Overactivation of this system can lead to glomerular hypertension and protein leakage, both of which accelerate CKD. By modulating RAS activity, vitamin D lowers intrarenal pressure and protects the kidneys from stress-induced damage. Emerging research also highlights vitamin D's role in enhancing the kidney's regenerative capacity. While damaged kidneys have limited self-repair ability, vitamin D fosters a supportive environment for renal cell survival and repair, slowing the disease's progression. Lastly, vitamin D influences insulin sensitivity and glucose metabolism, both of which are critical for patients with diabetes-related kidney damage. By helping regulate blood sugar levels, vitamin D minimizes further harm to the kidneys, particularly in diabetic CKD. Number 9. Improving quality of life for dialysis patients. Vitamin D significantly enhances the quality of life for individuals undergoing dialysis, addressing both physical and mental challenges associated with this demanding treatment. Its multifaceted benefits create a ripple effect, easing symptoms and promoting overall well-being. One of the key roles of vitamin D in dialysis patients is its ability to strengthen bones. Dialysis often disrupts the balance of calcium and phosphorus, leading to brittle bones and a higher risk of fractures. Vitamin D supplements restore this balance, reducing discomfort and enabling better mobility for patients who may already struggle with physical limitations. Another profound benefit lies in vitamin D's influence on muscle health. Dialysis can lead to muscle weakness and fatigue, making everyday tasks more difficult. By promoting muscle strength and function, vitamin D helps patients maintain independence and enjoy a more active lifestyle despite their condition. The cardiovascular benefits of vitamin D also shine in dialysis patients. These individuals are at higher risk of heart complications due to fluid retention and blood pressure fluctuations. Vitamin D improves heart health by reducing arterial stiffness and enhancing blood flow, mitigating some of the cardiovascular risks associated with long-term dialysis. Additionally, vitamin D supports immune function, which is particularly crucial for dialysis patients who are more susceptible to infections due to their treatment regimen. A robust immune system helps protect against illnesses that could further compromise their health. On a mental health front, vitamin D plays a vital role in alleviating mood disturbances, such as depression and anxiety, which are common in dialysis patients. By positively influencing brain chemistry, it contributes to improved emotional well-being, making the journey through dialysis more manageable. Moreover, vitamin D helps mitigate the symptoms of dialysis-induced inflammation. Chronic inflammation can lead to persistent discomfort and fatigue, affecting a patient's overall quality of life. Vitamin D's anti-inflammatory properties provide relief, enabling a more comfortable experience. For dialysis patients dealing with persistent fatigue, vitamin D offers an energy boost by enhancing cellular energy metabolism. This renewed vitality helps patients engage more actively with their surroundings and loved ones, improving their social interactions and emotional health. Furthermore, studies indicate that vitamin D may reduce complications related to dialysis, such as calcification in blood vessels and other tissues, which can lead to severe health issues. By minimizing these risks, vitamin D contributes to a longer and more fulfilling life for dialysis patients. Number 10. Forms of vitamin D, natural versus supplements. When it comes to vitamin D, there are two primary sources: natural forms obtained through sunlight and certain foods, and the supplemental versions that people often turn to when natural sources are insufficient. Each form has its unique benefits and challenges, and understanding the differences can help individuals make the most effective choices for their health, especially when managing conditions like kidney disease. The most natural and perhaps most efficient way to get vitamin D is through exposure to sunlight. When UVB rays from the sun hit your skin, the body naturally synthesizes vitamin D, which is then converted into its active form in the liver and kidneys. This natural process ensures that the body gets vitamin D in a form that is easily utilized. However, getting adequate sunlight can be challenging for many, especially those living in areas with limited sunlight or during the winter months. People with darker skin tones, older adults, and individuals who spend most of their time indoors may also struggle to produce enough vitamin D naturally. Furthermore, prolonged sun exposure can increase the risk of skin damage, which creates a balance that needs to be managed. Certain foods, such as fatty fish, salmon, mackerel, egg yolks, and fortified dairy products, are also good sources of vitamin D. But even a well-balanced diet may not provide enough vitamin D, especially for individuals with specific health concerns, such as kidney disease, which can impair the body's ability to activate vitamin D from food. For individuals who cannot get enough vitamin D from natural sources, supplements become a crucial option. Vitamin D supplements are available in two primary forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D3 is derived from animal sources, such as fish liver oil, and is the preferred choice for supplementation, as it is more effective at raising vitamin D levels in the blood compared to vitamin D2. Both forms are available over the counter in various strengths and formulations, such as tablets, capsules, liquid drops, and chewables. For individuals with kidney disease, supplements are often necessary, as the kidneys are less able to convert vitamin D into its active form. In such cases, doctors may prescribe higher doses of vitamin D or its active form, calcitriol, to ensure that the body maintains optimal vitamin D levels for proper calcium regulation and overall health. While vitamin D supplements can be effective, they come with their own set of considerations. Overuse of supplements can lead to an excess of vitamin D, which can be toxic and cause issues such as hypercalcemia, high calcium levels, kidney stones, or calcification of tissues. For people with kidney disease, monitoring vitamin D levels is critical to avoid toxicity and maintain a delicate balance. Another challenge is that vitamin D absorption from supplements can vary based on an individual's digestive health. For example, people with certain gastrointestinal conditions or those who are on medications that affect nutrient absorption may require adjusted doses or alternative delivery methods, such as injectable forms of vitamin D. To achieve the right balance of vitamin D, it is essential for individuals to work closely with their healthcare provider, particularly if they have a health condition like kidney disease. For many, a combination of natural sources and supplements may be necessary. Sun exposure, when done safely, should be encouraged, but it should be supplemented with foods rich in vitamin D and, when needed, high-quality supplements. Number 11. Sunshine and kidney health. When it comes to supporting overall health, few things are as fundamental as vitamin D, which is primarily synthesized through exposure to sunlight. While sunlight is essential for a variety of bodily functions, its impact on kidney health is particularly significant and often overlooked. Here, we will explore how sunshine influences kidney function and why maintaining appropriate sun exposure is important for individuals with kidney disease. Sunlight is the most natural and effective way to boost vitamin D levels in the body. When your skin is exposed to ultraviolet B (UVB) rays, it triggers a chemical reaction that produces vitamin D, a crucial nutrient for regulating calcium and phosphorus levels, which play a vital role in maintaining bone health and other body systems. For individuals with healthy kidneys, sunlight exposure helps maintain vitamin D levels that are necessary for a variety of processes, including boosting the immune system and supporting cardiovascular health. However, for those suffering from kidney disease, this process becomes more complicated. Healthy kidneys are responsible for converting vitamin D into its active form, which is crucial for calcium metabolism. But in individuals with kidney disease, this conversion is impaired, making it even more important to maintain adequate vitamin D levels through external sources like sunlight and supplements. Vitamin D is essential not only for bone health but also for kidney function. It helps prevent the calcification of tissues and the accumulation of phosphorus in the blood, which are common complications for those with chronic kidney disease (CKD). Adequate levels of vitamin D help protect the kidneys from further damage by regulating calcium absorption and minimizing excess calcium in the blood vessels. Moreover, studies have shown that individuals with chronic kidney disease (CKD) often suffer from low vitamin D levels, which can worsen kidney function. This underscores the importance of both natural sunlight exposure and supplementation for kidney disease management. Sunshine exposure, when done in moderation, can be a beneficial natural way to support kidney health. By spending short periods of time outdoors in the sunlight, especially during the morning or late afternoon when UV rays are less intense, you can help maintain healthy vitamin D levels. This can, in turn, support kidney function and help reduce the risk of complications related to bone health and vascular damage. However, it's important to strike a balance when it comes to sun exposure. Prolonged sun exposure without protection can lead to skin damage, premature aging, and increased risk of skin cancer. Therefore, it's essential to enjoy the sun in moderation and use sun protection such as sunscreen, hats, and protective clothing when spending extended periods outside. Vitamin D's influence on the immune system is another reason why sunlight is beneficial for kidney health. It helps modulate the immune system by reducing inflammation and preventing the body from overreacting to infections. This can be particularly beneficial for individuals with kidney disease, as they are more susceptible to infections and inflammation. For kidney disease patients, it is essential to have a balanced immune response. Too little vitamin D can impair immune function, making it more difficult to combat infections, while too much vitamin D can cause an overactive immune response that can contribute to kidney damage. Sunlight helps regulate this delicate balance. While sunlight is crucial for vitamin D synthesis, individuals with kidney disease may still need to rely on vitamin D supplements, especially if they have advanced stages of CKD or live in areas with limited sunlight. For those who are elderly, live in northern latitudes, or have darker skin tones, obtaining sufficient vitamin D from the sun may be difficult, making supplementation even more critical. Additionally, kidney disease patients often require specific forms of vitamin D, such as calcitriol, the active form of vitamin D, which is not easily obtained from sunlight alone. In these cases, doctors may recommend a combination of sunlight exposure and vitamin D supplements to maintain optimal levels. While sunshine is an essential source of vitamin D and plays a vital role in maintaining kidney health, it is important to consider how sunlight exposure interacts with kidney disease. For individuals with kidney conditions, ensuring that vitamin D levels are adequately maintained through sunlight, diet, and supplementation is key to preventing further kidney damage and improving overall health. As always, it's best to consult with a healthcare provider to determine the most appropriate approach for individual needs. Number 12. Foods rich in vitamin D. In addition to sunlight, another effective way to boost vitamin D levels, especially for individuals with kidney disease, is through dietary sources. While the sun remains a natural primary source, many people, particularly those living in regions with limited sunlight or who are unable to spend time outdoors, must rely on food to help meet their vitamin D needs. Fortunately, certain foods are packed with this essential nutrient, and incorporating them into your diet can have significant health benefits. One of the best dietary sources of vitamin D is fatty fish. These fish are not only abundant in vitamin D but also provide essential omega-3 fatty acids, which are beneficial for heart health. Fatty fish like salmon, mackerel, sardines, and trout are particularly rich in vitamin D, offering a natural and bioavailable form of the nutrient. Regularly consuming these fish can significantly boost your vitamin D levels, supporting overall health, immune function, and kidney health. For those with kidney disease, it's important to consume fish in moderation, as excessive amounts of certain types of fish may contribute to an overload of phosphorus or potassium. However, fatty fish remains one of the most effective ways to obtain high-quality vitamin D. Dairy products such as milk, yogurt, and cheese are often fortified with vitamin D, making them an excellent choice for boosting your intake of the nutrient. Fortification is a process where vitamin D is added to the product to help improve overall nutrition. While these foods are also a good source of calcium, which is essential for bone health, the added vitamin D helps support the body's ability to absorb calcium and maintain bone density. When choosing dairy products for vitamin D, opt for those that specifically state "fortified with vitamin D" on the packaging. Low-fat and non-fat versions of milk and yogurt are also available for those who are managing their calorie or fat intake while still aiming to get adequate amounts of vitamin D. Eggs, specifically the yolk, contains small amounts of vitamin D. While not as concentrated as fish or fortified foods, eggs can still contribute to your overall vitamin D intake. They also provide essential nutrients like protein, omega-3 fatty acids, and various vitamins and minerals. Eggs are especially beneficial for individuals with kidney disease, as they are a high-quality source of protein that is easier on the kidneys compared to some animal proteins. Consuming eggs regularly, particularly in moderation, can support your vitamin D levels and provide other essential nutrients for overall health. For those who follow a vegetarian or vegan diet, fortified plant-based milk alternatives, such as almond milk, soy milk, oat milk, and rice milk, can be an excellent substitute for dairy. These plant-based options are often fortified with vitamin D to mimic the nutrient profile of cow's milk. When selecting plant-based milk, it's important to check the product label to ensure it is fortified with vitamin D. Many of these plant-based milks are also fortified with calcium, which further supports bone health and other essential bodily functions, making them an excellent choice for individuals with kidney disease or those looking to boost their nutrient intake. Mushrooms, particularly those exposed to ultraviolet (UV) light, are a natural plant-based source of vitamin D. While most mushrooms contain only small amounts of vitamin D, UV-exposed varieties, such as maitake mushrooms or shiitake mushrooms, provide a higher concentration of vitamin D2, ergocalciferol, which can help boost your vitamin D levels. Mushrooms naturally produce vitamin D when exposed to sunlight, and consuming UV-exposed mushrooms can offer an excellent alternative for individuals with dietary restrictions or preferences. Incorporating these mushrooms into meals can provide a plant-based option for those seeking to increase their vitamin D intake. Cod liver oil is another powerful source of vitamin D, containing significant amounts of the nutrient in every serving. This supplement is derived from the liver of codfish and has been used for decades as a traditional remedy for various health concerns. In addition to vitamin D, cod liver oil also provides omega-3 fatty acids and vitamin A, both of which contribute to overall health. While cod liver oil can be highly beneficial for boosting vitamin D levels, it's important to use it in moderation. Due to its high concentration of vitamin A, excessive consumption can lead to toxicity. Always follow recommended dosages and consult with a healthcare provider before introducing any new supplements into your routine. Although it may not be a common food in many diets, beef liver is an excellent source of vitamin D. Like cod liver oil, beef liver is rich in vitamin D along with other essential nutrients like iron, vitamin A, and various B vitamins. Although organ meats like beef liver can be rich in cholesterol, their nutrient density can be a valuable addition to the diet in moderation. For individuals with kidney disease, it's important to consume beef liver sparingly, as organ meats are high in protein and can place additional stress on the kidneys if consumed excessively. However, when eaten in moderation, beef liver can provide a significant boost to your vitamin D intake. Number 13. Combining vitamin D with other nutrients. While vitamin D is crucial for maintaining kidney health and overall well-being, its full potential can be realized when it is combined with other nutrients that support its absorption and function. Certain vitamins and minerals work synergistically with vitamin D to maximize its benefits, particularly in promoting bone health, boosting immune function, and improving kidney function. By understanding which nutrients complement vitamin D, you can optimize your health and better support your kidneys. One of the most well-known synergistic relationships is that between vitamin D and calcium. Vitamin D plays a pivotal role in helping the body absorb calcium from the foods we eat and ensuring that calcium is deposited in the bones where it is needed. Without adequate vitamin D, the body cannot effectively absorb calcium, even if it is present in the diet. This can lead to weakened bones, a condition known as osteomalacia or rickets in severe cases. For kidney health, balancing calcium with vitamin D is essential. People with kidney disease are often at risk of calcium imbalances due to impaired kidney function, which affects calcium regulation. Ensuring that both vitamin D and calcium are consumed in appropriate amounts can support bone density and help prevent kidney-related complications, such as bone disease or cardiovascular issues associated with calcium imbalance. Magnesium is another mineral that plays a significant role in the activation of vitamin D within the body. While vitamin D is absorbed through the skin or ingested from food and supplements, it requires magnesium to be converted into its active form, calcitriol. Without adequate magnesium, your body may struggle to fully utilize the vitamin D you are consuming, even if your intake is sufficient. Research has shown that magnesium deficiency can hinder the effectiveness of vitamin D, potentially leading to reduced bone mineralization and a weakened immune response. Therefore, ensuring that both magnesium and vitamin D are part of your diet is crucial for optimal health, particularly in individuals with kidney disease who may already experience magnesium imbalances. Magnesium-rich foods include leafy green vegetables, nuts, seeds, whole grains, and legumes. Incorporating these into your diet alongside vitamin D sources can help improve the bioavailability and effectiveness of vitamin D in the body. Vitamin K2 is a lesser-known nutrient that works synergistically with vitamin D to ensure that calcium is properly regulated in the body. While vitamin D helps calcium absorption, vitamin K2 directs the calcium to the bones and teeth, preventing it from accumulating in soft tissues, such as the arteries and kidneys. This is especially important for kidney health, as improper calcium deposition in the kidneys can lead to kidney stones or calcification, worsening kidney disease. A deficiency in vitamin K2 can result in calcium being deposited in tissues where it shouldn't be, which can exacerbate kidney damage. By combining vitamin D with vitamin K2, you help ensure that calcium is properly used by the body, which supports kidney function and prevents unnecessary mineral buildup. Zinc is another mineral that works hand in hand with vitamin D to boost immune function. Both nutrients are vital for regulating the immune response, and a deficiency in either can lead to a weakened immune system. Zinc helps activate vitamin D and ensures its receptors are working properly, enhancing its ability to fight infections and inflammation. For individuals with kidney disease, maintaining a strong immune system is critical, as kidney disease often leads to an increased susceptibility to infections. Ensuring adequate zinc and vitamin D intake can support immune function and reduce the risk of infections, particularly in dialysis patients or those with compromised kidney function. Omega-3 fatty acids, commonly found in fatty fish and plant-based sources like flax seeds and walnuts, are essential for overall health, including kidney function. These healthy fats possess anti-inflammatory properties, which can complement the anti-inflammatory effects of vitamin D. Chronic inflammation is a major concern for individuals with kidney disease, and a combination of vitamin D and omega-3s can help reduce systemic inflammation, thus slowing the progression of kidney disease. Additionally, omega-3 fatty acids support cardiovascular health, which is closely linked to kidney health. By combining omega-3s with vitamin D, individuals can enhance both kidney and heart health, which are often affected together in kidney disease. Collagen is the most abundant protein in the body and plays a key role in maintaining the structure and integrity of tissues, including those in the kidneys. Collagen synthesis requires various nutrients, including vitamin C, zinc, and vitamin D. Together, these nutrients help support tissue repair and regeneration, which is crucial for individuals with kidney disease, as the kidney's ability to regenerate and repair themselves can be compromised. By combining vitamin D with collagen-supporting nutrients like vitamin C and zinc, you can help maintain the structural integrity of the kidneys, support healing processes, and prevent further damage to kidney tissues. The health of the gut microbiome plays a significant role in the absorption of nutrients, including vitamin D. Probiotics, which are beneficial bacteria found in fermented foods and supplements, can help improve gut health and enhance the absorption of vitamin D. A healthy gut microbiome facilitates better digestion and nutrient absorption, which is especially important for individuals with kidney disease who may have digestive issues related to their condition or medications. By combining vitamin D with probiotic-rich foods such as yogurt, kefir, and fermented vegetables, you can improve gut health, enhance vitamin D absorption, and promote overall well-being. Number 14. The importance of monitoring levels. Monitoring your vitamin D levels is essential to ensure that your body is receiving the right amount for optimal health, especially when managing conditions like kidney disease. Too little or too much vitamin D can have significant consequences, making regular monitoring crucial to strike the balance necessary for maintaining healthy kidney function and overall well-being. This proactive approach can help you avoid the potential risks associated with vitamin D imbalances and take steps toward optimizing your health. One of the primary reasons for monitoring vitamin D levels is to avoid deficiency. Vitamin D plays a critical role in many bodily functions, including immune system regulation, calcium absorption, and kidney health. A deficiency in vitamin D can lead to weakened bones, an increased risk of infections, muscle weakness, and even kidney disease progression in people with pre-existing kidney issues. By regularly checking your vitamin D levels through blood tests, you can identify any deficiencies early on and take steps to address them before they worsen, preventing serious health complications down the line. On the other hand, it's equally important to avoid vitamin D toxicity, which occurs when there's an excessive accumulation of the vitamin in the body. High levels of vitamin D can lead to hypercalcemia, a condition where calcium builds up in the blood, causing nausea, vomiting, kidney stones, and even kidney damage. By regularly monitoring your levels, you can ensure that you do not exceed the recommended limits and adjust your intake accordingly to prevent toxicity. For individuals with kidney disease, monitoring vitamin D levels is even more crucial. Kidney disease can impair the body's ability to activate vitamin D, making it more difficult to maintain optimal levels. Insufficient vitamin D levels can worsen kidney function over time, so it's essential to track your levels to ensure they are within the healthy range. A healthcare professional can provide specific recommendations based on your condition, such as increasing vitamin D intake through supplements or adjusting dietary sources, to help protect your kidney function. Regular monitoring allows for personalized supplementation plans. While sunlight and diet are the natural sources of vitamin D, supplementation might be necessary for individuals who have difficulty absorbing the vitamin, or those with medical conditions like kidney disease that hinder its activation. Monitoring your levels helps your healthcare provider determine the appropriate dosage of supplements to keep your vitamin D levels within a safe range. Additionally, factors like age, body weight, geographic location, and lifestyle can affect vitamin D absorption, necessitating more frequent monitoring to maintain the balance required for kidney and bone health. Vitamin D is just one part of the puzzle when it comes to kidney and overall health. By keeping track of your vitamin D levels and other vital health markers, such as calcium, magnesium, and phosphorus, you can create a comprehensive health strategy that addresses all areas that impact kidney function. Regular checkups with your doctor, blood tests, and assessments will allow for adjustments to your treatment plan based on your specific needs and risks, helping you maintain the best possible health and reduce complications associated with kidney disease. Number 15. Consult your healthcare provider. When it comes to managing your kidney health, especially in relation to vitamin D and its potential role in disease prevention or management, consulting your healthcare provider is crucial. They can offer expert guidance tailored to your individual health needs, ensuring that you're on the right path for both treatment and prevention. It's important to recognize that kidney disease and the need for vitamin D supplementation can vary significantly from person to person based on several factors like the stage of kidney disease, pre-existing conditions, and overall health. One of the primary reasons to consult with a healthcare provider is to receive personalized health advice that takes into account your specific condition. Kidney disease patients often have unique medical needs, including how vitamin D is metabolized and utilized. Your doctor can assess your current health status, take into account any other medical conditions you may have, like diabetes or high blood pressure, and recommend the most effective plan for incorporating vitamin D into your overall care strategy. This tailored approach ensures you receive the right dosage and avoid the risks associated with self-prescribing or taking an improper amount. For people with kidney disease, vitamin D supplementation may be necessary, but it must be approached with caution. Oversupplementation can lead to toxicity, and improper dosing can have adverse effects on kidney function. A healthcare provider can help you navigate the safe use of supplements and monitor your blood levels to ensure they stay within a healthy range. They can also recommend specific forms of vitamin D, such as D2 or D3, that are best absorbed by your body and most effective in promoting kidney health. Kidney disease is often influenced by other risk factors like high blood pressure, diabetes, and lifestyle choices. Your healthcare provider can identify these factors and provide a comprehensive strategy that integrates vitamin D with other necessary treatments. In some cases, managing these underlying conditions may reduce the risk of further kidney damage and improve overall health outcomes. Your doctor may also advise on lifestyle changes like diet, exercise, and stress management to optimize kidney function and support your health on multiple fronts. Regular checkups with your healthcare provider are essential to assess your kidney function and vitamin D levels. Kidney disease can be progressive, and monitoring its impact is key to making adjustments in your treatment plan. A doctor can order lab tests to assess kidney function, such as creatinine levels and glomerular filtration rate, and check for any changes in your vitamin D status. Based on these results, your provider can suggest modifications in supplementation or lifestyle to better manage kidney health and prevent complications. By consulting with your healthcare provider, you gain access to valuable education and resources that can empower you to make informed decisions about your health. Kidney disease is often complex, and understanding the relationship between vitamin D and kidney function is an essential part of managing the condition. Your doctor can explain how vitamin D interacts with other nutrients, its role in reducing inflammation, and how it supports the immune system, helping you grasp why maintaining optimal levels is important for long-term kidney health. A healthcare provider doesn't just prescribe medications. They work with you to develop a comprehensive care plan that involves monitoring, adjusting, and coordinating treatments over time. This collaborative approach ensures that every aspect of your health is addressed, from vitamin D levels to diet, exercise, and other therapies. A well-rounded care plan will be more effective in slowing the progression of kidney disease, reducing symptoms, and improving your quality of life. If you're at risk for kidney disease or have early-stage kidney damage, consulting your healthcare provider about vitamin D supplementation can be a proactive measure to prevent further complications. Your provider can help you understand the role of vitamin D in preventing proteinuria, reducing inflammation, and supporting kidney health, potentially reducing your risk of progression to more severe stages of kidney disease or even kidney failure. In many cases, people with kidney disease also have comorbidities like high blood pressure, diabetes, or heart disease. These conditions can complicate kidney health and affect the absorption and effectiveness of vitamin D. A healthcare provider can help you manage these conditions alongside kidney disease, ensuring you're not only addressing one issue but taking a holistic approach to your overall health and wellness. In conclusion, by incorporating vitamin D into your routine through diet, sunlight, or supplements, under medical supervision, you can take a significant step toward better kidney health. If you found this video helpful, give it a thumbs up and share it with your friends and family, because everyone deserves to know the secret to better health. Don't forget to subscribe and hit the notification bell for more life-changing health tips. Let's take charge of our health together.